The biggest thing with any autistic child or any child in therapy is you need to build a bond. You need to build a relationship. If you don't have a relationship with a child, they're not going to talk to you. And you're not going to teach them anything. When I just started off as a speech therapist, it was never my intent to work with autism. I don't know, everyone thought they loved it, and I didn't know if I really wanted to do that. And then I ended up seeing all the autistic kids. I worked in the government, and then I worked in private practice in Windhoek, and I don't know, I ended up seeing all the autistic kids. And one time I was talking to one of my friends, an occupational therapist, and she said, you know what, maybe it's because you also have a few sensory difficulties. And I'm like, I don't know, should I be proud of this? Should I be offended? But I think it also helped me as a therapist to also remind me that we all have a few quirks, and it's normal, it's fine. So what I sometimes try to do is, if I get a child referred to me, then there would be a diagnosis or there would be symptoms. So they would say inability to relate to others. So I try to put it in my mind in a better way, to rather say they find other kids less interesting than the rest of the universe, or inappropriate playing with toys, but they're playing in a way that makes sense to them, but maybe not to us. So it's important to keep in mind, because as a therapist or as someone that works with children with autism, you tend to get to a point where you only see the negative things, but it's also important to think of it in a different way. So what do? I'm going to just give an oversight because I actually want to get to a specific point tonight. So we assess and we work with prelinguistic skills, what Dr. 𝗘𝗽𝗏 said, communicative intent, eye contact. Well, actually not eye contact. I never work on eye contact because if you're a clown, I promise you they're going to look at you. You just need to get into their world, then they are going to look at you. So if you're boring, no way, they're not going to look at you. Joint attention, are they turn-taking? Are they able to take turns? Cause and effect, imitation, pointing, matching. So those are the prelinguistic skills. These are the skills that need to be in place before you can expect a child to actually use speech. So if they're a bit older, then usually I start to refer to pragmatics. So are they able to respond to the greet me? Can they maintain a topic to a certain amount of time? Initiate or terminate the topic or a conversation, all of those things. Then I also look at nonverbal communication, because what we see in a lot of autistic children is they really struggle to speak. So some of them can't speak at all. Usually when they get to me, they can't speak at all. So I look at nonverbal communication. Maybe something that I should mention is alternative and augmentative communication. Yes, it is what a speech therapist should engage into. Like, I should be the one that help them with the app or something to assist them in communicating if they can't communicate. But a speech therapist is not a gatekeeper. I'm not that person that's going to say, you're not allowed to introduce AAC without a speech therapist. Anyone can introduce that. So just maybe keep that in mind. What we also say is speech. But with autistic children, usually what you see is they can't say the k or the r or the whatever sound. It's more expressive language, and that's where I want to get into tonight. I want to talk about Gestalt language processing. So usually what we see is normal developing children. They would start with one word, and then 2 years, they have 2 words. And usually what we see with autistic children with hyperlexia, it can be, remember, autism and hyperlexia usually goes hand in hand, but it is not also necessary. Hyperlexia means they have the ability to read, but they can't really keep maybe in conversation. So Gestalt language processes, and I think that's something that I really like, because we always think there's only one way, but there are actually 2 ways of learning language. And that's where speech therapy comes in. So usually they have echolalia. So they have these language they have these chunks that they talk into. They won't say good morning. They would have they would sing the old MacDonald song to you or something like that. They speak in third person. They have pronoun reversals. Dr. 𝗘𝗽𝗏 spoke about the pronoun reversals and is speaking in third person. The reason why they do that is because they're only repeating it as they hear it. They don't really understand what you're talking about. So they're just basically repeating it. So that's why it sounds a bit funny, because you're always the one saying, Robert, you need to do this. Robert, you need to pick up your toys. So if they talk about, they're like, Robert needs to pick up the toys, because that's what you're saying. So they're basically just repeating. So that's why it doesn't make sense to them. And then that's why you have it where they replay a specific part of a specific clip over and over and over again, because they're trying to make sense of that. And as a therapist, I try to not say too much sometimes, because you get some of my children, they repeat word by word the exact conversation that I had with them 6 months ago. And then I'm like, oh my word, what did I say? And that's just their way. They felt a certain way in that session. So they're repeating that, not because they just want to copy me, but because they had that, maybe they had it was a good session. So they're repeating that to try to express, like, I had a good day and that was a good day, but now it sounds like I'm just copying Ansie. But it's actually their way of expressing. It's a completely different way than what we used to, but it's also completely normal. What you also see is, in the beginning, language seems to be very inflexible. So they would repeat only certain phrases or certain chunks the whole time. And as they develop, and as you see therapy starts to kick in, then they start to use spontaneous speech. Then you see that they're changing those little chunks and they're adding the chunks together to make little sentences, maybe not still completely spontaneous speech, but they're starting to put them together. And as they go along, they start to, it's completely spontaneous. Then you also get where they have these unintelligible speech, like you just can't understand what's going on, and they're la 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 la, just going on. It's literally, it sounds ridiculous to say it, but it's literally, their little mouths can't keep up with what they wanted to say, because they have this whole script in their head, and they want to say all of that, but they just can't keep up with them or themselves. So it's literally like their mouths are a bit slower than their brains. And then you usually see what other people call abnormal intonation, but it's actually, if you listen to them, if they repeat a certain, I have a little girl, and she's now past that stage, she loved, it was the 𝗔𝗀𝗀𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏 McDonald song. I don't know how many sessions I had the Old MacDonald song, like I think 10 times in my session. And it was every single time she put emphasis on a different part of the Old MacDonald song because she was trying to tell me, oh, this is a pig, you know, because it's about farm animals. But she didn't know how to say pig, so she was taking little chunks out of that song the whole time to try to tell me something. Sometimes you need to listen to the emphasis. Where do they put the emphasis? And obviously, the biggest thing with any autistic child or any child in therapy is you need to build a bond. You need to build a relationship. If you don't have a relationship with a child, they're not going to talk to you, and you're not going to teach them anything. So what is therapy? It's basically intensive interaction. I only have 30-minute sessions. So those 30 minutes, I basically just give. I give as much as possible because they can only concentrate for that much and they're only able to take in that much. So yes, 30 minutes a week might not sound like a lot, but it is a lot for them because it's quite overwhelming if you talk to them the whole time. What we also see with Gestalt language processes, they're very musical. So they laugh. I mean, you know, the first thing that they do is they play the ABC song over and over and over again. That's their way of learning language. What I do in therapy is I sometimes have these random songs. So I maybe don't have the nicest voice, but I just make up songs as we go along because I love it. And that's their way of learning. If they're a Gestalt language processor, it's easier for them to learn through music than it's necessary through just speaking. So that's what I always say. Play music, let them replay that song over and over again, because those chunks are going to help them to eventually get to a stage where they can use spontaneous speech. What we also see is the language use is very situational. We see that they tie it, like I said the previous time, they tie it to a certain experience or a certain feeling. And then it also happens that they don't speak at home and they speak to the therapist, and it eventually evolves and get to a stage where they realize they also need to use what I'm teaching them. They need to use it, you know, at school as well. So it's quite a process. But please do yourself a favor. Look at, you can Google it, Gestalt language processing. It really shows you a completely different side of autism and how they learn language. Because it's not the same with screen time. I see a lot of normal developing children that also are Gestalt language processors, because they also learn that's what they're exposed to. Let me just quickly say something. Usually what I do is if a child is autistic and has hyperlexia, is you use those strengths to make sure that the weaknesses get better. So if a child is hyperlexic, they would be able to read, but they can't hold a conversation with me. But then I use a book because I love the books, and I use a book to teach them how to speak and which situations can we use those chunks, and eventually we get to a stage where it's more spontaneous. That was a mouthful. Please feel welcome to ask more questions. I'm always open, and thank you.